Good afternoon. Mahalo for joining us for today's Health Human Services hearing on Friday, April 17, 2026 at 1 p.m. We are convened in room 225. We'd like to introduce my other members, which is Senator McKelvey as my vice chair.
Yeah,
And we have Senator Keokolole. Oh, we have quorum, so we can go through this. Thank you. This meeting is being streamed live on YouTube. In the unlikely event that we must abruptly end this hearing due to technical difficulties, committee will reconvene to discuss any outstanding business at 1:01 p.m. Monday, April 20th, 2026 in room 225. A public notice will be posted on the legislator's website. To facilitate this hearing in a timely manner, we will be enforcing a 1-minute limit on testimony, and I will be reading a list of individuals who submit written testimony for each measure. We apologize if the closed captioning does not accurately transcribe the names. If you're interested in reviewing the written testimony, please go to the legislator's website. You'll find a link on the status page for the measure. We appreciate your understanding and remind you that the committee does have your testimony, that I reviewed them, so I encourage you to use your time to either add additional comments or you can stand on your written testimony. First up, HCR 18, requesting the Department of Health to convene a hospice working group to examine trends and regulations in the hospice industry. First up, we have, testimony. We have Department of Health providing comments.
Good afternoon, Chair, Vice Chair, and members of the committee. My name is Paula Serio. I'm the chair or the chief for the Office of Healthcare Assurance. Because of the Office of Healthcare Assurance's role is enforcement focused, we believe that we are not the appropriate entity to lead this work group, which is intended to objectively review the hospice industry. Doing so would prevent a conflict of interest, as regulators should not be directing or shaping the industries they oversee. The work group's charge examining trends in a broader industry dynamics also fall outside of our scope, which is limited to compliance oversight rather than assessing market behavior or operational practices. Nevertheless, we remain committed to collaborating with hospice providers and their associations should we work towards developing administrative rules and licensure standards that help support patient safety. Thank you for this opportunity. I'm available for questions.
Okay, thank you. And I correct, that's not comments, it is in opposition. I see that on your title, but not in the body. So thank you very much. Next, it's Navi and Hawai'i in support.
Hey, Chair, Vice Chair, Richmond Lazar. We submitted a additional piece of testimony that supersedes the written testimony that we had submitted earlier. In light of some of the concerns that we had talked about with stakeholders, we have two amendments. Number one, rather than Department of Health being the chair of it, it would be a legislator. We talked to the House Committee on Health, and they said they would be willing to chair it. And then the second one is there was a provision that says the hospices have to be established before 2000 in the state of Hawaii. There were some concerns about that as well, so we'd be okay with taking that out of the reso also.
Okay, thank you very much. Okay, anybody else wishing to testify in HCR 18? Members, any questions?
questions answered.
Okay, thank you very much. Okay, moving on, HCR 32, requesting the governor's senior advisor for mental health and the justice system to formulate a plan to increase access to the Hawaii State Hospital for certain mentally ill criminal defendants. First up, we have Office of Hawaiian Affairs and Support. Next, we have Department of Health, Behavioral Health Administration providing comments. Next, we have Dr. Michael Champion. Oh, unless you're Department of Health, come on up, Dr. Matsu. You're standing on your written testimony. Okay, it says comments, but now it's in support. Okay, I'm just looking at your written testimony. It says providing comments.
Yeah. So we stand our written testimony. We're committed to working to look at the system and working together with the senior advisor to.
Okay, so you're now in support of the measure and you're willing to work. Okay,
Well,
thank you.
Come on, comments.
Reflection's not their idea.
That's fine.
Thank
Thank you. Okay. Dr. Michael Champion providing comments.
Michael Champion from the Governor's Office, Chair, Vice Chair, stand on the written testimony, commenting.
Okay, thank you very much. We have Louis Urchik in support, Josh Frost from ACLU providing comments. Anybody else wishing to testify in HCR 32? Members, any questions? Okay, seeing none, moving on. HCR 35, requesting the auditor to assess the social and financial effects of mandatory health insurance coverage for biomarker testing.
Good afternoon, Chair, Vice Chair, and committee
Wait a
members.
second, you're not Jack Lewin, are you?
Oh.
You don't look
Oh,
like
no.
Jack Lewin.
Okay.
Okay, I will call you when your time is up. Thank you very much. Okay. No, it's okay, it's okay. Thank you for being, for being willing to testify, but we'll get there. Okay, Dr. Lewin, for SHPTA in support. Okay, Kobe Chalk in support. For Alzheimer's Association. Kathleen Amston, lupus and allied diseases in support. Okay, Josie Gamas of American Kidney Fund in support. Okay, John Lamb, Charles Mark Jackson, and Ron Lanton of AACU, American Association of Clinical Urology in support. Primo Castro in support of Biotechno Innovation Organization, Hawaii Primary Care Association in support, Cynthia Owen support, American Cancer Society, Mark William in support, Cheryl Okuma in support, Jennifer Hosler in support, and we got Hawaii Women Lawyers in support, Pedro Haro in support, 1, 2, 3, 4 other individuals, all in support. Okay, anybody else wishing to testify, come on up. Identify yourself.
Thank you, Chair, Vice Chair, and committee members. My name is Shane Morita, and this is on behalf of HCR 35. I was born and raised in Hilo. I've been a surgical oncologist in Honolulu for 18 years. I serve currently on the board of directors for the American Cancer Society here locally in Hawaii. I'm also the medical officer. I would like to strongly support and humbly ask for your endorsement for this bill to help biomarker testing for our cancer patients. It's really been a paradigm shift in the way cancer patients are being treated. No longer is cancer being looked upon only one type of disease as far as a site. It is what we call, we have tumor agnostic therapy, meaning we can treat cancer based on how it looks on the microscope and all the different genes and whatnot. So I really appreciate your endorsement. Humbly ask for your support. Thank you so much.
Thank you very much. Okay, anybody else wishing to testify on HCR 35? Members, any questions? Okay, we also have Senator Kanuha, but we lost Senator Keokalolo. We're trading places here.
Thank God I didn't
Okay, we
bring my
still have quorum.
forms. I just
Okay.
waited. The only constant is favela.
Okay, next one is HCR 105, requesting the Hawaii State Center for Nursing to compile a comprehensive list of recommended safe patient staffing ratios for all nursing specialties and subspecialties across all healthcare settings and to maintain a repository for this information. Okay, first up, we have Laura Reichert, Board of Nursing, Hawaii State Center for Nursing, providing comments.
Aloha, Chair, Vice Chair, members of the committee. Thank you so much for hearing this resolution. The Center for Nursing, as you can see in the testimony, has already started the work on this. We're more than happy to do the work. And it's consistent with our longstanding initiatives. We pivoted our mission and our vision last year to prioritize well-being in the workforce.
Thank you very much. Next, we have Hawaii American Nurses Association in support.
Stand on my testimony.
Thank you very much. Anybody else wishing to testify on HCR 105? Members, any questions? Okay, seeing none, moving on. HCR 173, urging Maui Health to collaborate with stakeholders to establish a full-time medical residency program on the island of Hawaii. On Maui, excuse me, on the island of Maui. Sorry.
Claim jumping.
Okay. We have SHPTA in support. Dr. Lewin.
Yes, thank you, Chair, Vice Chair, members. Yes, we think this is a great idea. There's already a residency program in kind of informal process there now, but we need to formalize it. We need to double the number of people in it. We defer to Maui Health in terms of the cost of this whole kind of thing. But should be there to help, and we think rural health transformation dollars will fund this kind of a program. So let's move it forward.
Thank you for that.
Okay, thank you very much. Next, we have Yasmin Ching, Hawaii State Commission on Status of Women in support.
Good morning, Yasmin Cheney for the Commission on the Status of Women. I stand on my written testimony in support of this measure and would just like to bring to the committee's attention the need for more robust pregnancy care providers in Maui County in addition to primary care, as there are a lot of folks that are having to travel off island to deliver. So thank you very much.
Okay, thank you. And I apologize for always mispronouncing your name. I
You get it
try.
No worries.
You
Try.
can examine the end of the year.
Thank you. Next, yeah, by the end of the year, I should be able to figure it out. Okay, Samuel Shoemaker, University of Hawaii, and support Elizabeth, Dr. Ignacio for Hawaii Medical Association and support. Anybody else wishing to testify in HCR 173? Members, any questions? Are ready for decision making? Okay, so first up, we have forum. First up, HCR 18, requesting the Department of Health to convene a hospice working group to examine trends and regulations we got everyone except for one. In the hospice industry, Chair's recommendation is to pass with amendments. We will accept Navian's proposed testimony, and we're gonna have the House lead the working group.
You want to throw me on there?
Or state
Yeah,
or
yeah,
Senate
well-
designee, sure, if you're willing to do it.
I'm totally willing to do it because this is actually an issue that's coming to a head in
That's
Maui as
fine,
well.
that's
So,
fine, okay,
More
good.
than happy to work with
So we'll
everybody.
have the vice chairs of both House and Senate co-chair this thing. Okay, any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, recommendation on HCR 18 is the Senate Draft 1, no excuse to Senator Pavella, all members present, and EWR is no. Seeing none, recommendation is adopted, Chair.
Okay, thank you very much. For HCR 32, Chair's recommendation is to pass with tech amendments. We're going to also change the title to align it with a be it resolved clause as requested by SMA. Any comments, questions, concerns? Pass with amendments only for tech. Okay, seeing none, Vice Chair for the vote.
Okay, recommendation HCR 32 is the Senate Draft 1, no in the presence of all members except Senator Pavella, and EWR is no. Seeing none, recommendation is adopted, Chair.
For HCR 35, biomarker testing, Chair's recommendation is to pass as is. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
All right, recommendation HCR 35 is to go as is, noting excuse absence, Senator Pavella, and EWRs are no's of the members. Seeing none, recommendation is adopted.
For HCR 105, we're going to take Laura Reichert's proposed amendment, which is basically insert on page 3, we're going to replace the word ratios to strategies and ratios, and any additional tech amendments as recommended by SMA. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, recommendation on HCR 105 is a Senate Draft 1, no excuse to Senator Pavella, all members present, and EWRs are no's. Seeing none, recommendation has been adopted.
And for HCR 173, Chair's recommendation is to pass with only tech amendments. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, recommendation HCR 173 is a Senate Draft 1, no excuse to Senator Pavella, all members present, and EWRs are no. Seeing none, recommendation is adopted.
And with that, we are adjourned.